The mission, vision, values work is something that I find is the most overlooked aspect of what companies do. And a lot of people have worked at companies where it's just words on a wall and it doesn't mean anything. We're in an industry where we're actually caring for humans. And the values don't have to be some magic set of words. It can be focus on the patient, or we care, patient's number one, right? If that's not in your values, you get out of the business, I would say, to start.
Hi, everyone. My name is Mariam Treystman from the Home Health Consultant, and today we have the pleasure of having Austin Degenhardt, Managing Partner of HHA Pros Consulting. Thank you so much for joining us.
Well, thanks so much for having me on.
What advice would you give to an agency that's smaller, they're starting out, they want to grow, they want to get to the level where they would work with you? What would you tell that person?
I mean, the first thing I would tell them is, I'll start in the sales process. Focus on true sales fundamentals, not what you've learned from home health marketing. I believe we haven't touched much on sales and marketing, so I'll touch here if you don't mind. You should follow a more traditional sales process. You should call and schedule appointments. You should show up on time for those appointments. You should, snacks and stuff like that. I loved not bringing any snacks because I'm not here to sell you snacks. I'm here to truly position ourselves as a business that I genuinely believe that your patients are better off in our hands than they are at any other home health agency. So from a leadership perspective, the first thing you can really do is start on your mission, your vision, and your values. If you haven't clearly articulated why you do this, what your mission is, where you want to be, what your vision is, and what your core values are, where if anyone in your organization, including yourself, crosses those, that's a major problem, sometimes a fireable offense. If you start at the core of your mission, vision, and values, and you articulate that clearly and you believe in it, from there, that should be infused into all of your messaging, internally, in hiring, in firing, in leadership meetings, in QAPI, in anything. Why are we doing what we're doing should always tie back to mission, vision, or value. It simplifies decision-making in leadership. It simplifies hiring because you can see if someone doesn't have a certain value. It simplifies firing because if someone crosses that value, you can say, hey, you didn't keep your integrity with the patient. You took a selfie, whatever the weird thing is, we got to let you go. And you don't have to think about it and question it. You crossed the core value, you're done. Once you start there, then when you get out marketing, all of that work that you did on mission, vision, and values all comes out. And your confidence level when you're out in the community gets to such a higher point because you believe in your mission, you believe in where you're going, and you know what your core values are, which those tend to end up being your promises that you're keeping to community partners and patients. So that's the thing that they could really do is do that work and then follow a simple professional sales step. Call a case manager, call a director of case management, introduce yourself, schedule an appointment to stop by and visit. Follow up after that appointment and say, hey, I'd really like to schedule an in-service with your case management team. I realize y'all are busy. We could do it on Zoom, Google Meet, Teams, whatever works for you. Or I'd love to come by in person and bring some snacks if your hospital's okay with that. Always be respectful and transparent, but push and ask professionally. When you leave an encounter after an in-service, you should have a little phrase that you use, something like, I'd really appreciate one shot. If you send us one of your patients and they do even half as well as the rest of our patients, I think you're going to be very impressed. Does that sound fair enough? Ask. Get a yes or no. So much of marketing is, hey, Susie, good to see you. Any referrals coming up? No, not right now. Okay, keep me in mind. That's okay. But you got to do that on repeat every single day, in and out. You have to be in front of their face. You're interrupting their time. So if you can focus on a little more professionalism on that side, and B, it helps to have a CRM to stay organized. But yeah, Mission, vision, values, and professional sales approach would be the two first things. I have like six more, but I'll stop there for now.
Amazing. So I think this is really good advice. From our end, we have a lot of people asking how to grow, how to just things like this. That's not really our strong suit. So I think people will find a lot of value in just this conversation. Is there anything else that you feel like we didn't cover, or uh, any other tips that you want to give people?
Yeah, the mission, vision, values work is something that I find is the most overlooked aspect of what companies do. And a lot of people have worked at companies where it's just words on a wall and it doesn't mean anything. We're in an industry where we're actually caring for humans, and the values don't have to be some magic set of words. It can be focus on the patient, or we care, patient's number one, right? If that's not in your values, you get out of the business, I would say, to start. But the values don't have to be rocket science, but those really translate to everything else. When it comes to marketing, there's two little things that I would suggest that people do. One is, after you have started care with a patient, you go back to the referral source and tell them that.
Mm.
If it's a case manager, you can do it on all scripts. If it's a doctor, if you have someone's cell phone number, you can text them, whatever the least impactful way is, but let them know, hey, patient Regina S., don't fall into a HIPAA compliance issue. Don't use full names or dates of birth, but just let people know, hey, we started care with Sally S. today. Everything's good. If something isn't good, if you're missing information, anything like that, get back to them quickly. If it's a hospital or a SNF, they want the patient out. Help them with that. Get to them timely. Respond on all scripts. So on any referral clearinghouse, like CarePort or ADA, you should be responding. 5 minutes is the maximum. Where we got to in San Francisco, 2 minutes was the expectation of responding yes or no to a referral. That's a lot of processing to do, but that helped position us for getting the volume. So that was a big one. And then the other one is, call your patients after they've discharged. Call your patients 1 or 2 months later, ask how they're doing. Have a little script, something like, hey, this is Austin calling from Health Now, Home Health. You were on our service. Your nurse, Regina, was caring. I don't know why Regina's in my head. Your nurse, Regina, was caring for you. We just wanted to check in and see how you're doing. If you do that for every single patient and their families, right? Because sometimes families will answer the phone. They might actually remember your name the next time they're in the hospital or a SNF. It's possible. B, it just has this positive impact where that's how you'll start getting more referrals organically, because you are providing a next level of customer service. That's really where my biggest focus would be, is if you provide customer service, it's one of the only ways in a commodity type service business that you can edge yourself up over someone else.
Right. And on a best case scenario, you might catch them in a time of need. So
it happens. And then you go, oh, wait, your doctor, Dr. Johnson, right? Would you like us to call him and ask for a referral? Boom, business.
yeah, done.
Yeah.
Easy. Amazing.
Yeah.
Wow. Well, how interesting. I love your system. I love that you guys are helping people do better with what they already have also. Of course, you can always increase referrals, this, that. There's a whole world of that, but just tightening the ship of that process is so important too. Even in, we used to do tech, so we had an EMR at some point, and one of the biggest kind of like elements that you're looking out for is to reduce churn. You want to do the best with what you've got before you start to grow and then like have a really leaky bucket. So I really like what you're doing. I think it's really cool and helpful for a lot of agencies, and helpful for the agencies that need to be the ones growing.
Yeah.
So great job. Amazing. Any last words, any other comments for our audience?
I just want to say thank you for having me on. And this has been a really pleasant conversation. It's been fun and interesting. And I appreciate you having this platform and getting the word out there. I know what it's like to manage a podcast, and it can be a little heavy, but uh, I think that what you're putting out there for your audience is really valuable. And I appreciate being able to be a part of it. And I hope people got some value and some actionable items they can take from here.
And can you let people know how they can get in touch with you if they're interested in your services?
Yes, LinkedIn is kind of the best place for me now. The company is HHA Pros, like Home Health Agency Pros. And so on LinkedIn, that's the best spot. I'm not really big on other social media platforms. And then Austin at hhapros.com. If you have any questions, concerns, thoughts, anything that if you heard the podcast and wanted to talk more, learn more, or any of that kind of stuff, I'd welcome any kind of conversations like that.
Perfect. And we'll make sure that we link all your info so that people can easily get in touch with you. It's been a pleasure talking to you. And again, this is Austin Degenhardt from HHA Pros Consulting. And I'm Mariam Treystman from the Home Health Consultant. Thanks, guys.
Thanks so much, man.
Bye.